Hi everyone, my name is Mallory. I'm one of the pharmacy residents that is doing the diabetes support group with you. I'm going to do a quick introduction and review what we talked about last week, and then Kat is going to talk about our topic this week. So we're going to recap and then do our next topic. So from our last meeting, we met the new residents. We met myself, Nazar, and Kat. We have our pictures up here for you to look at. And we also learned about the COVID vaccines. We talked about how the emergency authorization process works. And we talked about how vaccines work against different viruses and disease states. And then we also discussed the safety, efficacy, and administration of the COVID vaccines. And just a little update for you guys about the COVID vaccine. The FDA recently approved booster vaccines in people who are immunocompromised and people who are 65 or older. So if you have any questions about that, definitely reach out to your doctor or your pharmacist. And now let's hear from Kat.
All right, thanks Mallory for the introduction. So this time I thought we would do a little talk about what it would be like or what concerns would arise for people with diabetes who are wanting to travel now that hopefully it will be safe enough to do so in the near future. So I'm going to discuss here, so you can see, air travel, car travel, and I thought about cruise ship travel, just in case. I know that these are not the only modes of vacationing or travel, but these I feel like would be the most common to kind of come up with questions or concerns about, and these things could be extrapolated further into other modes of transportation or other means of traveling. So when we're thinking about traveling in the air or you're flying somewhere, first thinking you have to go through security, so what can you bring with you? So according to the FAA and TSA, all medications related to diabetes, including your supplies and equipment, anything related to diabetes care, is allowed to come through you on your person or in your carry-on item. So that would obviously mean your oral medications, any insulin or injectables that you currently use, your testing supplies, so lancets, test strips, glucometer, even thinking a little bit further, glucose tabs or glucose gel if you have it. So all of those items are allowed to be with you and travel with you through security. If you happen to have an insulin pump, I know those are not uncommon, but your pump equipment, anything you would need to help with your pump or troubleshoot your pump, those items are also allowed to be with you on your person in your carry-on. So I've just got a quick tip here that I pulled from the FAA website. While you're going through security, if you place your medications in their own clear Ziploc bag, it may make your transition easier through security. And if you are concerned about that exclusively, it's even easier if you have your medication labels with you and with those items as you're traveling through security. So I know a lot of times you might throw it in a pill box, and that's fine too. I don't want to discourage you from disrupting your routine by not having your pill box with you, but if you also have your medication labels, like if you tear them off of your bag at the pharmacy, you can, if you have those in there, it might make it easier still. Another question you might have is, well, I have to have my insulin in the fridge, but I made a quick little slide for you so you can reference on how long your insulins or injectables are okay outside of the freezer. So you can just plan ahead. Speaking of plan ahead, best practices when traveling are to plan ahead. So make sure that when you're planning your trip, you can time your refills accordingly with your outpatient pharmacy and make sure that you have enough refills. If you don't have refills, make sure that you are aware of that in advance, because it does take time for the pharmacy to send that request to your physician and the physician to approve that and get it back to the pharmacy. I know that that doesn't happen usually within one day, and especially not over a weekend, or if you're looking at traveling over a holiday, expect even longer delays. So I would say at a minimum 2 weeks ahead of your trip to make sure that you have enough refills to travel with you on your trip. Some insurance companies will even allow like a vacation override, so you could potentially have an extended amount of testing supplies and medication to travel with you on vacation. So again, plan ahead. And I would make sure that you have planned in your trip itinerary time to stop by the pharmacy and pick that up. And I would say no later than 1 day in advance. I would even say a couple of days in advance, just in case things aren't finished at the pharmacy yet. They are also experiencing some staffing shortages in outpatient pharmacies, and so their time to complete prescriptions is even longer than it was pre-COVID. So just bear that in mind. So I'm going to transition now to traveling in a car or taking a road trip. All of the above things that we discussed with traveling in an airplane are still true. You should still plan on having enough medication with you for the duration of your trip, or have made an advanced plan to pick it up at a local pharmacy along the way if you're traveling far anyway. So make sure that you have contacted those pharmacies just in case. I'm just thinking ahead, if you're on an oral medication that's a brand name product such as Januvia, for example, that was the first one that came to my mind, making sure that you call that pharmacy ahead of time and make sure that they have that product available and on the shelf for you. Let them know that you're traveling from out of town and will be stopping on whatever day that you're planning. So planning ahead is going to be your best bet in all of these situations. Not all pharmacies carry the exact same things and in the exact same quantities that you need. Make sure also that your insurance will cover you from state to state. So those are just things to be thinking about in advance. Also on a road trip, I would recommend packing a cooler. Bring a cooler with you that has ice packs. So one, you can store your insulin in there or injectables if you desire, but also so that you can keep food that you know is going to keep your blood sugars even and not spike or drop you on the road. You should definitely plan on packing sufficient supplies for the duration of your trip. So this is including lancets and testing strips and alcohol swabs, glucose gel, glucose tabs, all of those things. I think that packing a sufficient amount is sufficient, but packing extra is only going to serve you in the long run, just in case something happens. I feel like things are bound to happen when we plan road trips, so luck favors the prepared. And then a different way, or another way we can take care of our diabetes on the road is to track your carbs. I know we don't always eat the same on vacation or on trips than we do at home. And so fast food or stopping at truck stops and just grabbing whatever's quick and what's easy, which is fine, and that's part of the fun of going on trips because it's not all the time. But being mindful of keeping a consistent carb intake for when you're on the road. And I've listed here just a couple of apps that I found from the American Diabetes Association for tracking carbs and tracking your food. So the first one I'm listed here is MyFitnessPal. You can get the app on your phone. That's Android or Apple. There's one called Fooducate, and then Blue Star Diabetes. So all of these are free apps for you to use. They all have different benefits and cover things that the others don't. If you need help figuring those out, you can always email us and we can maybe put together like a step-by-step for you with some screenshots. I would venture to guess we'd even be willing to call you on the phone and help you through those if you would like us to do that. And then last little tip I have here for road trips are to bring your own snacks. Bring snacks that you know you like and that are good for you. Something like a low sugar yogurt that's going to have protein in there, as well as a little bit of carbs, but that protein is just going to help keep your blood sugar stable longer. Cheese sticks, the same thing, and then some hummus, same thing, and you could have that with like celery sticks or carrot sticks, or even some pita chips if that's what you desire, and you plan ahead for that. And so lastly, I want to talk about being on a cruise ship with diabetes. So following the guidance that we have from air travel and road trips, planning ahead, bringing sufficient medications and supplies with you. I contacted a couple of different cruise line companies, and most of them all have, regardless of what cabin you're in, they have mini fridges in the cabin for you to store things in. So just being mindful of that. You could keep your snacks in there. You could keep some medications in there if need be. I would also encourage you, if you're traveling by cruise ship and you're planning on taking some excursions, plan ahead here and know what excursions you're going to take, when you'll be leaving, when you'll be coming back, and being able to take the things that you need with you on these excursions. So take your insulin with you. Take some glucose tabs just in case. Bring your testing equipment with you. Most of our glucometers come in a pretty small case, so you could easily slip that in a purse or backpack with you on your excursions, just so you don't get sick while you're away from the ship and have a bad time. That would not be what we want for a vacation, not much of a vacation. So finally, here is, I made just a little chart just so you were aware of how long various injectable medications are stable outside of your refrigerator. So all of these dates that you see here are outside of the refrigerator in like the first time you use it. So short-acting insulins like Humalog and Novolog are good for 28 days out of the refrigerator after your first use. So you have about a month, so if you're planning on more than a month, then you would need to keep another vial with you and keep it in a refrigerated state. Long-acting insulin, Lantus, Toujeo, Levemir, and Tresiba. So you can see these have varying times. So Lantus is 28 days, just like Humalog and Novolog. Toujeo, although it's the same insulin as Lantus, just a more concentrated insulin, it's good for 56 days out of the refrigerator. Levemir is good for 42 days, and then Tresiba is also good for 56 days. So just things to think about. And then non-insulins like Victoza and Ozempic. Victoza, each pen is good for 30 days. Ozempic, 56 days. So you've got 1 or 2 months outside of the refrigerator, just so you can plan accordingly for your vacation. And I would like to say here, just making sure that you understand that these are, don't take them out of the refrigerator and then put them back in for extended stability, it doesn't work. Once it's out and you've used it once, that time starts then. And also should note here that the insulins such as Humalog, Novolog, Lantus, Tagea, Levemir, and Tresiba, all of those dates are the same whether it's in a vial or whether it's in a pen. So I looked all of those up ahead of time just in case I needed to add dates for whichever mode of, whatever mode it's in. And that's all of the things that I thought that you should know when traveling with diabetes. If you do have any questions, our email here is on this final slide, diabetes support group at srhc.com. We're happy to take any questions you have or any comments. If you have anything that you would like for us to say for you and describe for you or make a presentation about, please just let us know. We're happy to take those calls. Thanks.